Okay. Hello, colleagues. This is Vice Chair Marchand. My machine just suddenly decided to restart. So I was booted off, but now I am back on and I'm looking for Madam Chair. It's our
Bear with
intention.
us one moment, please. One more minute.
We aim
Thank you.
to restart very soon.
Thank you so much.
Our apologies again to colleagues, Chief Alston and everyone else who's in attendance. We were experiencing just a couple of technical problems, which we hope to resolve in just a moment, and then we will begin. Thank you so much for your patience.
No worries, sir.
Thank you.
Hello again, everybody, colleagues, members of the public, members of city staff. We should be starting in just a moment. Pardon the delay due to some technical difficulties, but we expect to start any minute now. Thank you again for your patience.
I've never seen anything like this before in my life.
Vice Chair Marchand, is there a way that I can help?
Thank you for the offer, Chief Alston. I think we are ready to proceed. So I would invite colleagues to return to the meeting. We have found what we were looking for, and we should be able to proceed. I just want to definitely establish a quorum as present, and then I will kick off the meeting.
Thank you, Alder Marchand, Vice Chair Marchand. You have the floor.
1, 2, 3, 4, 5, 6. I see 6 and 7 and 8. Okay, let's begin. Welcome, everybody, to the Finance Committee meeting for the month of January. I will begin by reading the notice. Aldermanic Notice, New Haven. The Finance Committee will hold a public hearing on Monday, January 11, 2021 at 7 p.m. via video conference. Meeting can be viewed at https://bit.ly/2jpjyjx or by phone at 646-558-8656. Meeting webinar ID 944-3571-0543. Phone passcode 575-29807. The Finance Committee will hear the following item. OR 2020-0034. Ordinance amendment to appropriating ordinance number 1, authorizing budget transfer number 202-21-1, transferring funds from expenditure reserve account in the amount of $1,900,000 and $1 million from the fire suppression account to the fire suppression overtime account. This item is filed with the city clerk and may be inspected at room 202, 200 Orange Street, New Haven. Per order, the Honorable Yvette Hamilton, Chair. Attest, Michael Smart, City Clerk. If you need disability-related accommodation, please call 3 business days in advance, 946-8122-VOICE or 946-8582-TTY. The public may join the meeting and may send public comment to public-testimony@newhavenct.gov via video conference. Meeting can be viewed at https://bit.ly/38jkwgp or by phone at 301-715-8592. Meeting webinar ID 913-1056-1950. Phone passcode 526-81197. Thank you, everybody. As is customary, we will begin with a roll, the attendance of alders who are present. Alder Hamilton, Chair.
Present.
Alder Adam Marchand, Vice Chair. I am here. Alder Santiago.
Present.
Alder DeCola.
Present.
Alder Morrison.
Present.
Alder Walker Myers.
Here.
Alder Festa.
Here.
Alder Furlow. Alder Evelyn Rodriguez.
Present.
Alder Hurt.
Present.
Alder Decker.
Here.
Thank you, everybody. The Vice Chair recognizes Alder Abby Roth, who has also joined us. A word about how we proceed. Our Chair, Alder Hamilton, has asked me to run the meeting. She anticipates she may need to leave shortly for other pressing business. So I will conduct this meeting this evening, and we will proceed as we have for the past several months. We will first hear from the maker of the item. The request comes from the administration, and I see that Chief Alston from our fire services is here, and I expect other city staff to come. They will present their request and their rationale for why this transfer is required. Then we will have questions from members of the committee of our city staff, after which we will go to the public for their testimony, and then we'll deliberate. As per our custom for finance meetings, we are asking colleagues please to stay within 4 questions. Although at the chair's discretion, if at the end of going through the committee we have time, we could always go back for a second round. And depending on the number of members of the public who sign up to testify or who indicate a desire to testify, we may impose a time limit, but that will be at the discretion of the person running the meeting. That's me. And it depends on how late the hour is and how many people ask to testify. So that's the procedure that we will adopt for this evening. And without further ado, let us welcome our city staff. I see Chief Alston from the Fire Services. I see our Budget Director, Michael Gormany. And we would ask you 2 gentlemen, please, to introduce yourselves with your names and addresses.
Yes, sir. Good evening to the committee, both chair and vice chair, aldermanic council, and my counterparts and colleagues of department head and budget director, Mr. Michael Gormany. Good evening. John Alston, 952 Grand Avenue, New Haven, Connecticut.
Thank you, sir. Mr. Gormany.
Good evening, everyone. Michael Gormany, 165 Church Street, New Haven, Connecticut.
Thank you. Please begin.
Thank you, sir. Can everyone see that screen? It says overtime contributing factors. And in respect to the time, I will be brief because there may be things that I've already covered. Even though this is a different meeting, there may be repetition. Overtime contributing factors this year, in addition to our normal contractual obligations, we are in the midst of a pandemic which has had a resurgence of 2 spikes. One in the summer, we've had one right after Thanksgiving, and we also are now starting to see the effects of a holiday spike for the new year. Over the course, and I know we're in a fiscal year, but I'm tracking this from when we began tracking our overtime for COVID, March 20 to January 21st. We've had 305 members placed off duty. Obviously not all at one time. Of those 305, only 38 have tested positive for the coronavirus. The reason why you see the large number of members is our agency is not like any other city agency. We actually live with each other. We eat, sleep, and well, let me correct that. Firefighters do not sleep, they rest between alarms. However, when we respond, we're responding in close quarters. Some things are not avoidable or unavoidable, and we run the risk of community spread. The pain and anguish I hear from other fire departments, not just in Connecticut, but across the country, many of them large community spread. In other words, they are losing an entire shift. They have to rely on mutual aid. Many of them are having 30 and 40 members out on a shift, which those departments are the same size as ours or smaller. I again credit the team that I work with. Early on, we had tried to address these issues by making sure that we had protocols in place, making sure we had the proper equipment to disinfect and decontaminate, as we are a department that goes directly in to places where patients are COVID positive. We also had a tropical storm, Isaias, over the summer, which we had to provide make safe crews and emergency operations staffing during that storm. We did have another snowstorm recently, not as massive as we've had in the past, thank God, but again, we still had to call in additional crews. We also have contractual obligations because of the new contract that was negotiated in November 2019 of increases in salaries. We also had staffing shortfalls. We have 9 retirement positions that we need to staff. And then we have position vacancies. Those position vacancies are being addressed. The only one that is being held up right now is the lieutenant's exam. We're awaiting the results of that. And so we'll be able to promote lieutenants. But until that time, we're utilizing overtime to staff those positions. We've had COVID-19 has had a major impact on our department, both with the number of exposures and positive cases, but also having to close a house temporarily while we take care of our members who may or may not have been exposed, making sure that they were properly tested, contact tracing take place, and if positive, treatment, but also having to hire overtime to replace them so that we would not take any house out of service. New Haven is a very unique system of emergency medical services and fire and all hazard response, that it is very critical for us to be able to make sure that our houses go back online as quickly as possible. So we have a process of decontamination. We also assigned folks to the COVID inspection task force, because as you know, we had to start going out based on the governor's guidelines and the mayor's executive orders to ensure that places were operating safely, not going over their occupancy, and ensuring that they were adhering to all the guidelines and protocols, again, to reduce community spread. And that's tough when you're going into businesses. Our hearts go out to the businesses in New Haven who are struggling. We understand that, but we also have to keep our population safe. This disease, this virus, not only spread rapidly in our community early on, but now there is a new strain that spreads even faster. So we assigned folks to decontamination duties, reopening inspections, and unfortunately, with more people staying home during this time of COVID, we've had an increase or an uptick in fires. We're tracking our COVID overtime at about $304,000. Now that's spread across 2 fiscal periods. How it works is once it is coded as COVID and we submit reimbursement to FEMA, the federal government, we get a 75% reimbursement rate with FEMA. And I believe, I'll have to check with Mr. Gormany, I believe it's 25% from the state in terms of reimbursement. But we also know that that takes time to get those reimbursements. Our fire incidents have peaked, obviously, during the summer and also moving into the winter during the holidays as well. Unfortunately, we did have a fatal fire last year that claimed the life of one of our residents. And so our concern is to make sure that we're keeping our people safe, our citizens safe, our firefighters properly trained, properly outfitted, part of a team, and have all of the proper PPE that they need to respond to keep them from contracting the virus. Tropical Storm Isaias, we provided make safe crews that whenever trees came down, we provided firefighters to ride along with the make safe crews to ensure that the trees were removed and that the live lines were neutralized, but also power restored. There was also staffing of the Emergency Operations Center. We utilized backfill for those who were unable to make it into work, because when the snowstorm and the tropical storm hit, there were members who could not make it into work. we had to hold people over, order them to stay, and also hire in other crews that could make it in. And unfortunately, currently, it is not a declared federal emergency, so there may or may not be reimbursement for that tropical storm. However, we are hoping with the new administration coming into the federal government that there will be a review of these types of incidents. The contractual factors, if we looked at our sick hours from 2019, they were 17,499 hours for the calendar year. We also had to honor our vacations and personal time for our members, funerals, and also earned personal days and sick in 2019. 2020, during the calendar year, we were up 1,000 or more hours. And what that does when we place members off sick because of COVID, what ends up happening is it limits the pool of persons that you can pick from to hire in on the overtime. Thus, the more you hire the same person working over a period of time exceeding 212 hours in a 28-day period, it triggers the Garcia, the Fair Labor Standard Act, which now makes their overtime time and a half. In terms of staffing, our delay in running an academy has been difficult. The Connecticut State Fire Academy did not run an academy, even though we are a regional school. We did not receive guidance right away. As you know, just like in the news, there was a delay in protocols and guidelines, both statewide, for different industries. But in ours in particular, we were not able to run an academy. Initially, that was not an issue because when this started, when we started to feel the impact of COVID, we still had members present. We started losing our members, to retirement in July of 2020. We did not receive guidance from the Connecticut State Fire Academy on how to run our academies, or if we were going to run our academies, until late October, November. There are still schools that are unable to run courses. So I tasked our team to come up with a cost analysis on how to run a safe COVID academy. I also did something else that was pretty controversial, but you pay me for ideas and you pay me to come up with solutions. And so we put out a survey to see if there were members who were already on our list that already had firefighter 1 and firefighter 2 and or paramedic and EMT, which would lessen their time in an academy, to see if we could run a modified or expedited academy. Of course, once we did that survey, we realized we still were not going to get the number of persons that we need. And so we may or may not be running a regular academy, but we are trying to think out of the box to find as lower cost savings, the best cost savings that we can, to try and replace the people that are leaving our system due to retirement. So we had a need to backfill positions, both in the firefighter rank, the lieutenants, which we don't have an active list currently to promote from. And we were able to get a deputy chief's list, and we were able to promote that person. Overall, our sick and injured was 6%, which was 18 members. That fluctuates due to injuries and long-term sick in our ranks, all of which triggers our Garcia, or the FLSA. As I've been trying to present for the last 3 years, is a 7-year analysis of our overtime, so that you have an idea of where we are and what our projections will be. Currently, unfortunately, our projection with our current rate for 2021 is going to be roughly $5.8 million. We are going to do everything that we can to get an academy class in. We're pushing HR to get the results of the lieutenant's test in, because we know that when we staff our positions and we have active lists, our labor costs go down and we end up paying the lowest cost for labor. But when we do not have that, and it's exacerbated by a tropical storm, snowstorm, and an ongoing pandemic, it is going to increase our cost. So we were budgeted at $2.1 million, and I will continue to say it until it is not true at any time. $2.1 million is not enough to cover my overtime budget. It never was. We on average are about 3.3 to 3.7 mil on a good year. So our gross currently to date is $3 million. Now, the COVID number that you see of about $75,000, that's currently under an internal audit. We were having issues with our Firehouse software, which is how we input our work hours, communicating with the city payroll system, which is Munis. It's been an ongoing issue that we have tried to address. I know Mr. Gormany's office has been terrific with his staff in trying to extrapolate those true numbers. I am estimating that our true numbers are going to be closer to $300,000 in COVID over those 2 fiscal years. So what we're attempting to do, we fortunately were able to put in position a management and policy analyst. We have a person now on staff who can work with the budget director's office to make sure that we are counting all of those COVID related expenses for reimbursement from the federal government, from the state. We have also in the process of negotiating an agreement for a software package that we want to use that adequately tracks our overtime, hiring, availability by specification, classification, and skill set. It'll also track our vacations so that, as we stated in other meetings, we will be able to make sure that we are staffing properly, but not allowing more officers to take off within a vacation period than is allowed to. And so what happens with the software is we take the human error out of it. And so we're very excited about that being promising. If you would look at what our current expenditures are, which are about $2.9 million, at the current level at 110 a week, 110K a week, we're looking at $5.8 million. My goal is to ensure that we get below the $110,000 mark. But with COVID, it is unpredictable. If I get an exposure, I have to shut that house down. I cannot take the chance of a firefighter contracting the virus, spreading it to other members of the firehouse, now responding to the public with members that are positive, and then allowing them to go home to their families. It is not the best of systems, but it is the best possible protocol and best practices that we know of to reduce community spread, to protect our community, and to protect our coworkers and our families. Mitigation items that we have on, again, we staffed a management and policy analyst for oversight, that is to do oversight for my office as well as for to report directly to the budget director. That person has been doing an excellent job, hit the ground running. Our goal is to make sure that we put the new software on. It is ready to be tested next week as a parallel system. We're looking to affect that for vacations this year. Increasing the monitoring of sick. As many of you know, my former assistant chief of administration retired last year in January and was off until March. We were blessed as a department to have acting assistant chief of administration, Raymond Sirocco, who retired today. And I want to go on the record to thank him for stepping in and stepping up to help manage our administration in the department. He dove in and did a tremendous job in carving out a lot of the issues we needed to make sure that we were handling properly with the implementation of the new contract. And then the last piece for mitigation are the promotions that we have planned for this week. We are promoting another captain this week. We are promoting a arson supervisor because Ray Sirocco retired from that position. And we are just pressing HR to give us the results as soon as they can with the lieutenant's exam. And I am confident that our costs will be driven down significantly there. I don't know if I missed anything, Mr. Gormany, I see you there. Or if I misspoke. It's a long day, so.
Yep. No, thank you, Chief. I think you covered everything in your presentation. So I think we can take questions from the committee.
Mr. Gormany, before we take questions, do you want to say anything about where the funds are coming from and why they're coming from those places, and maybe a little bit more about the COVID portion?
Sure. So the funds are coming from two areas. The funds are coming from the salary account. Due to various vacancies within the fiscal year, we are projecting that the fire department will have a surplus in the salary account of approximately $1.1 million. So we're using $1 million of that to cover the overtime expenditures that the chief is incurring in this fiscal year. And within that projection of a surplus of $1.1 million, the chief and I have talked about various hirings and different timings of classes in case they happen at certain times during the fiscal year. So within that surplus, within the salary account, we are already taking into account certain hirings for the chief. The second portion of the transfer is coming from the $4 million that the Board of Alders reserved this fiscal year within the budget, which was for COVID-related items or other expenditures as necessary for the fiscal year. So again, the budget in there was $4 million, which was set at the beginning of the year. So far to date, out of that account, we actually haven't used it yet, but there is an approved transfer for $800,000 for nurses from that account. Again, depending on what happens with school, we haven't used that funding yet. So even with that approved transfer, that still leaves a balance in that account, which is where we are taking the $1.9 million for the remainder of this transfer. I will forward the board. I did work on today the overall fire projection, which is a report that the board usually receives with the overtime request, which sort of just gives a general overview of the department. I apologize, the time got away from me today, so I just didn't have a chance to send that report off this morning, but I will send it to Al this week for you to review as far as where the overall department is and how we arrived to this number of $2.9 million as a transfer. But those are the two accounts that the funding is coming from. As the chief mentioned, we continue to work on the COVID overtime related to the fire department. I think there was just some coding errors in Firehouse between Firehouse and our financial system where some overtime was coded as regular overtime and it was really COVID overtime. So I know at the last committee meeting, finance committee meeting, I testified that the amount was around 43,000, which was in our monthly. As we continue to look at that number is up to 75,000 for COVID related overtime. So again, that will be part of our submission to FEMA. A lot of that happened in the October through December quarter, which is what my staff is working on now. So a lot of the overtime is still eligible to be reimbursed. The difference between that $43,000 number and the $75,000 number. So that will be included in our October through December submission that we are working on over the next few weeks to FEMA. So we'll just continue to monitor and work with the chief to make sure that we maximize every reimbursement dollar to the federal government that we can get in relation to COVID. So that's what I have. Thank you, Alder Marchand.
Thank you, Mr. Gormany. Thank you, Chief Alston. We will now go to questions from committee members. Our usual practice is that our chair starts with me. I'm the next on the list and we go down from there. So in the spirit of that, I'm going to start with the next person on the list after me so that I'll be last in line. And that is Alder Santiago.
I got no questions right now.
Thank you, Alder. Alder DeCola.
No questions at this time.
Thank you. Alder Morrison, questions?
No questions, Chair.
Thank you, Alder. Alder Walker-Myers.
Thank you, Mr. Vice Chair. I just have one question for Mr. Gormany. So if we don't take the funds from these two accounts right here that were proposed, is it another alternative or this is the only one?
I'm sorry, Alder Walker Myers. I was just waiting for your thing went in and I was just waiting for the question to finish.
Sorry, I'm sorry.
Nope, that's all right. So in looking at the transfer, I think I looked at every basic alternative that I can see within every department. What I tried to look at was really just seeing, is there one area where we have enough funding? Because what's going to end up happening is we're really just going to start picking and choosing from every department. And I think as we go on through this year, at every finance committee meeting, I've made it no secret, this is a tough year. We're running a deficit that keeps fluctuating from time to time. So I think expenditure reserve was really the only account that had the amount of funding along with what we're lapsing in salary for Chief Austin to make this transfer easily. So I hope that answers your question, President Walker Myers.
Yes, it does. Thank you.
Thank you, Alder Walker-Myers. Alder Festa.
Thank you, Mr. Vice Chair. I do have a couple of questions. In Chief Austin's presentation, it indicated that we don't necessarily budget correctly for overtime. And if that is the case, why, with budget season coming up, will that change for that budget? Will we be more realistic than what we have been?
So that's a great question, Alder Festa. I think that's one of the things that we're looking at as we try to get to a more structurally sound budget. As you know, that's one of the things that we struggle with is the police and the fire overtime year to year based on staffing levels and contract language and just other areas. The short answer to your question is yes, we really should look at increasing the overtime. So, we're not here year over year. But to be frank, there's also not a lot of areas in the budget to cut because we're at a level where the city budget is really going up by fixed costs, not programs or anything else. So I think what we're looking at for this fiscal year, especially with a year under Mayor Eliker's belt, we're looking at how can we sort of look at getting to those more structurally sound budgets as far as like the fire overtime and working with the chief within a number that he can within a number that's reasonable for the fire department. So again, it's sort of like a balancing act. And yes, we are looking at the actual number versus what's budgeted.
And if I may, Mr. Gormany and I have discussed lots of times since I've been here, talking about addressing what is our overtime really made of so that we have better indicators in the future, such as making sure that if it's for overtime for services rendered or overtime for backfill or overtime due to vacations, then have a breakdown within that. And I believe that software that it's not a panacea, but the software that we're looking at will give us accurate accounting of where we're spending our overtime dollars, other than the spreadsheets by rank. It'll give it to us by date and shift, and we'll be able to provide better analysis and better forecasting capabilities.
Chief, you just mentioned that software that was presented to us, I want to say back in the spring. What is the delay in getting it implemented?
Everything slowed down due to this pandemic. I know that it was presented, the RFA was done. We did an RFP process first. I believe even today, Mr. Gormany sent me documents, the contract was drafted. I reviewed the final draft of the contract. I'm okay with it. It now goes to the vendor signs it. It comes back to the mayor for his review and corporation council, and that will be the final piece. However, because this module is an add-on to one of the programs we've already been using, the implementation time is minimal. We're actually prepared to, we've tested it, we're prepared to run it in parallel beginning next year as long as the paperwork goes through the proper channels.
Okay, what do you mean next year? Like
Next week.
okay. So not next year, so
Next,
this year.
sorry. Yes, absolutely, next week.
Okay. Also, and this is probably more of a question for Mr. Gormany in regard to the state. We approved money from the state that that some of the funds were allotted to go towards police department, fire department, and public health. I think it was just over $3 million that we accepted. Why can't we use any of those funds for this versus touching the expenditure reserve fund?
No, that's a great question, Alder Festa. So a lot of times what we've done with these transfers is there has been a transfer approved, let's say up to $2.9 million, right? Sometimes in the final audit reports that you see, you won't see that full transfer done because we did not end up utilizing that full transfer. Again, I think it was just the timing of this transfer was submitted back in October, I believe, September and October. So at that time, we didn't know there was $3.1 million available coming from the state. So again, I think I would take that same approach basically of right now, I'm in the process of reconciling that $3.1 million. How much is going to be applied to where? Again, as I mentioned, when we were accepting the money, one of the priorities is our local match. If we end up reducing fire overtime, let's say by $1 million, then we would end up only needing to transfer over $1.9 million, even though 2.9 is approved. I am hesitant to say that we can amend this transfer only because it takes us about a month and a half to reconcile our FEMA expenses with FEMA. So I still don't know how much of that $3.1 million will be applied. I can give a guesstimate, but it may not be accurate at this time. But I do believe there will be a portion of that $3.1 million that is applied towards the fire overtime that was spent between July and December.
Okay, I appreciate that explanation. With that being said, would it make sense to just wait to reconcile everything at the end of the year towards, not that I want a deficit, but we always seem to quote unquote balance things out? Would it make sense to wait? Because by then we might know what is reconciled, what FEMA gives us, and if any other funds come in.
I wish I could say yes, Alder Festa, but the honest truth of it is FEMA takes years to do some of this stuff. I just got an email from our deputy CAO who was working with us on FEMA that we're just now getting a reimbursement from Storm Irene, which happened like 5 years ago. So I wish I could tell you, yes, we can wait until the end of the year, but that just may not happen in time. You know, I could have a guesstimate, but again, I think one of the things I found with FEMA and COVID is they are also now being very picky on what they reimburse and do not reimburse. So I can have some expenses in there, give you a number at the end of the year, but it may not be true and end up needing more of that 3.1 million than I anticipated. So again, I think it's more prudent to, you know, at least have a transfer approved. And then, you know, at the end of the year, again, if we don't end up using the whole 2.9, then it goes back to the expenditure reserve account.
Thank you, Alder Festa. That is the four
You know, just a,
questions.
yeah, thanks. Just a follow, just a comment, or maybe through you, Mr. Vice Chair, if we can
Sure.
have an update, because a lot of the money that we allot, like the 800,000 for the nurses, this funding for the fire department, it's up to that amount. Can we have, like, once we know what the funds were used, can we have an update on the reporting of the exact funds that were used and how much is being put back into, you know,
Sure.
either our expenditure reserve, et cetera. So through you, Vice Chair, if
So-
we could request that info.
We can
Vice
certainly
Chair,
make that
if I can-
request.
Sure. So what I can say, Alder Festa, is one of the things I think if you or I remember, or Vice Chair Marchand remembers, in the monthly report, you know, we have the original budget and the revised budget. So anytime you see a difference between that, so like right now in the monthly report, it shows $4 million as the original budget, $4 million as the revised budget. If that goes down, that means we transferred the money somewhere, right? So I think we also have that mechanism of the monthly reporting that we do. So we can certainly keep you updated.
So I think that
Yeah.
would be an appropriate moment, Mr. Gormany, to give that kind of update to this committee. We don't have a monthly before us this evening,
Right.
but I think probably next time we will.
Yep.
Thank you,
Thank
Alder
you.
Festa.
Thank you.
Moving to Alder Furlow, I don't believe he's with us. Alder Evelyn Rodriguez.
Thank you, Vice Chair. Chief Alston, did you mention in the prior workshop that we were looking at an 83% in emergency medical care in terms of response from our firemen?
Yes, ma'am.
Okay, so if you can help me, how many or what percentage would you say were related to substance or opioids? And have we considered reaching out to the state to relieve financial burden on the city due to the opioid epidemic, just as we've submitted to the state for reimbursement of COVID-19?
So I want to thank you.
Thank you.
I want to thank you for that question. As we will all remember very vividly, we had the largest overdose incident in our nation's history back in August of 2018. And one of those questions came up. I actually went with the mayor's task force at that time to find out how we could get reimbursement at that time. There is no mechanism to reimburse for staffing and overtime. They will reimburse us for equipment used, but because we hold a license for advanced life support and basic life support, it is the city's responsibility to respond. So then we said, well, how do we know that these are residents of New Haven? Because when we respond, if they're on the green, let's say, the address comes in for 165 Church Street. Once that person is transported to the hospital, they give the hospital their updated information. We don't have access to that based on HIPAA. So there's really no mechanism for us to attempt to recoup that. All that we can do is work with agencies and programs to reduce the response load and the response level. Now, here's the other thing, and I'll be brief because I know it's a long night. We have our statistics on when we respond to certain events. And what ends up happening is if I go to a fall, there's no way that I can determine whether that fall was caused by opioid use, trip, fall, or nothing else until that patient gets assessed and worked. It may be that that patient gets handed off to AMR for transport. It may be that our paramedic ends up riding in to assist with AMR on the transport, or we transport on our own. Once that information goes into an electronic patient care record, EPCR, we do not have that information. So what do? We have agencies that we work with AMR that share information with us blind information that doesn't give us the demographic information, but it will tell us the number of opioid calls that we've gone on or the types of calls that we're going on. And what we're doing is compiling that information, because we are hurting like other departments as well, because even with COVID, we are still seeing an uptick in opioid use. So I just want you to know we are aware of it, and we're attempting to garner as much money and also equipment that we don't have to have the city pay for. We've had other agencies donate or attempt to give us Narcan, if you will, because that's an expense that the city wouldn't have to pay for. So we have shared services with non-governmental agencies. So there are ways that we're cutting costs that way. But in terms of the response, it is our responsibility to respond. And I know it's not fair, because I know that some of the people that we are responding to are not from New Haven. But there is really, we have a responsibility to protect life. And so as long as they're within our city border, they activate the 911 system, we have to respond. So thank you for the question.
And the other question that I have is in reference to overtime again. You're indicating that if we have more full-time firefighters, that we would be able to decrease overtime. Is that correct?
That is correct. That has happened over and over again. Every time that we have hired a class and put them on the street and had active lists, our overtime has gone down.
Thank you, Vice Chair. Those are all my questions at this time.
Thank you, Alder Rodriguez. We will now move to Alder Hart.
Thank you, Mr. Vice Chair. At this time, I have no questions.
Thank you, sir. And next in the list is Alder Charles Decker.
Thank you, Mr. Vice Chair. I have no questions. Thank you.
Okay. I have a question, which is to Mr. Gormany. Is there not any funds available in vacancy savings that we could use to help fund this transfer?
So again, I think it goes back to President Walker Meyer's question of vacancy savings are really spread out through each department. I mean, the short answer is yes. I mean, if we wanted to go department by department and sort of pick out what we think those vacancy savings are, we could do that, but it would be a longer list transfer. Plus, some of those vacancy savings are offset by possible non-personnel other expenditures in the city. So again, I think, you know, seeing what the funding for expenditure reserve was basically reserved for, we found it that was the appropriate account at this time for that transfer.
Thank you for that response. Mr. Chief Alston, beg your pardon. I'm sorry to make you repeat yourself if this question does that, but you did mention looking for ways to seat a class even in times of COVID. What approvals will you need? Would there have to be like an executive order from the governor loosening some kind of regulatory requirement, or is this something that you can work out within the confines of our city government and the Corporation Counsel's office?
It is something that we can work out within the confines of our government, our local government. It takes 16 weeks for a firefighter to complete firefighter 1, firefighter 2, which is required by the state. We require all of our firefighters to be EMTs. So that number of weeks increases by another 4.5 weeks, 20 and a half weeks for us to get EMT. We have a paramedic list that we have, that part of their qualifications is to already have paramedic. There is a shortage of paramedics all over the nation. It's very difficult to get paramedics and even keep paramedics. They get poached by other departments. And so what we looked to do was we put out a survey to find out how many persons already were vested with Fire 1, Fire 2, and or EMT and paramedic, because what that would do is cut the academy time by 15 to 16 weeks, which would allow us to run a modified academy. Unfortunately, through that survey, there are not enough people that possess those certifications. And so we may have to go to a regular academy. now add COVID. We are looking at a blended academy. So basically we'll do portions of the class and training in a blended format, doing the cognitive, the didactic, psychomotor skill sets at the school. A lot of other academies are calling New Haven to see if we're putting on a class, because the shortage of academy seats is a problem statewide. But we will take care of New Haven first. We'll continue to investigate and research ways to run an academy as quickly as possible to replace those persons.
Thank you, Chief. I think through the chair, we'll ask you to keep us apprised of that, either through this chair or through the leadership of our board. That's important information.
Will do, sir.
Thank you, sir. I see that Alder Yvette Hamilton is not with us, so I will not call on her. What I would like to do now is go to the public. We may end up having additional question or two after the public is done. So please do not leave just yet, Chief Alston or our budget director, because you never know what may come up and colleague that may spur additional questions from colleagues. At this time, Mr. Lucas, is anyone signed up to testify this evening?
No one is signed up to testify, and there are no hands raised at this time. Well,
I see one hand raised, Mr. Chair, Mr. Lucas. Please promote Mr. Cannon. Good evening, President Cannon. You have the floor in regards to this item.
Good evening, Vice Chair Marchand. Thank you. Once again, good evening to everyone else also.
I'm sorry, sir. Name and address for the record, please.
Patrick Cannon, President Local 825, New Haven Firefighters, 350 Ferry Street, New Haven, Connecticut.
Thank you.
Previously was mentioned about reimbursements from FEMA. Just a question, are those FEMA reimbursements directed back to the fire budget, or do they go to general fund? I think that might be a question for Mr. Gormley.
Yes, and we will be sure to ask it. The format at this point is that you may make statements or ask questions, but the city staff are not going to respond until after you're finished, and then the committee will follow up with your questions.
Great, that's my question. Thank you.
Is that all, Mr. President Cannon?
Yes, Vice Chair Marchand.
Okay, thank you so much.
Thank you.
Anybody else from the public wishing to testify this evening? Anyone else from the public wishing to testify this evening? And for a third time, anyone from the public wishing to testify? I don't see anybody. But I think now is an appropriate moment to ask Chief Alston if he wouldn't respond to the question from Mr. Cannon in regards to where, or maybe Mr. Gormley, you can respond about where the reimbursement funds go.
Oh, I can answer that question. They do not come back to us. They go to the general fund.
Correct.
Long conversation I've had with Mr. Gormley and previous budget directors.
Right. So we set up, as I mentioned at previous finance committee meetings, we set up a separate fund for COVID in our accounting system where all expenditures go to. So what happens is when the money is received from FEMA, the 75% reimbursement for all eligible expenses goes directly back to that fund. So so any fire expenditures that are expended during the fiscal year are already moved out of the fire department and into that fund. So that is the answer. That is the reason to why the FEMA funds go directly to that account that we have set up. So that is the answer to President Cannon's question.
Great. I'm going to go ahead and just do a final call for members of the public. who wish to testify on this item? If you wish to do so, please raise your hand. I see a follow-up question from Mr. Cannon. I will allow it. Mr. Cannon, I think you're being promoted. Name, I know it's repetitive, but please, again, name and address for the record, please. You are currently muted, sir.
No worries. Patrick Cannon, 350 Ferry Street, New Haven, Connecticut. The question follow-up would be, is that 25% from the state also towards the general fund in reimbursements? And is this finance committee taking into account that these reimbursements are not coming back into the fire budget? They are going into the general fund. So the understanding that whatever expenditures we have are highlighted, that they're not reimbursed directly back to the fire budget. They're directly sent over to the general fund.
Great. We will definitely ask that follow-up question, but would you like to say anything else, or do you have any other questions that you would like to put on the table before we move forward?
No, thank you.
Okay, sir. Thank you so much for your testimony. Anybody else from the public wishing to testify? I don't know if either of you, Chief Alston or our budget director, would have anything further to say on this point. I know that Mr. Cannon did ask a follow-up question. If you have an answer for it, we'd be glad to hear it now.
Sure. No, I just want to clear it up that the funding that we get related to FEMA goes back to the separate fund. All expenditures are moved out of the general fund and into the separate fund that we have set up. So when we get the funding, it goes towards that other fund. And that is basically how the reimbursement works. Our local match, again, as we talked about, the 25% is just, we moved part of that out last fiscal year. And again, this board has set up an expenditure reserve account, which can include COVID expenditures for this year. So again, that, everything COVID related is accounted for separately other than the general fund. And I'll say it on this call because I know Mr. Cannon's here. If he has any follow-up that he wants to call me directly, that's fine also.
So, Mr. Gormany, whether the reimbursements are from the federal government directly or funneled through the state or come from the state, they will still go to that account, that fund.
Correct.
Regardless of the provenance of those funds.
Correct. We have to make that fund based on accounting standards that we have with federal reimbursements and other things. We have to make that account basically whole with the reimbursements.
Wonderful. Thank you, Mr. Gormany. Final call, any further testimony from the public? Seeing none, a motion is appropriate. Alder Morrison?
I'm calling that the public portion of this meeting be closed.
You're making that motion?
Make a motion.
The motion to close the public hearing portion has been made and seconded. Is there any discussion on this motion? Seeing none, I will call the roll. Alder Marchand, yes. Alder Santiago.
Yes.
Alder DeCola.
Yes.
Alder Morrison.
Yes.
Alder Walker Myers.
Yes.
Alder Festa.
Yes.
Alder Frillo is not here. Alder Rodriguez.
Yes.
Alder Hurt.
Yes.
Alder Decker.
Yes.
The motion to close the public hearing portion has passed. We are now ready for a motion. Alder Morrison.
I make a motion. Oh, I'm sorry. I messed up there. I was doing good.
Would you like to move the item?
To move the item. See, I was doing good. I make a motion to move the item.
Second.
The item has been moved and seconded. Is there any discussion? Alder Morrison.
I stand in support of this transfer. I mean, the chief comes every single year and asks for a transfer. We know in doing the budget, he's gonna come back mid-year and ask for a transfer. They gotta protect me and my constituents in the whole city of New Haven. And so sometimes that costs, and we have to be willing to pay the cost to make sure that we're protected. Last night I was laying down. In the middle of the night, I heard these fire trucks. They're across the street from my house, taking care of someone. Now, if we don't pay this money, that person, they may have not made it. But because the fire department is on their job, whatever it takes, overtime, triple time, whatever it takes, to make sure people are in place, to make sure that we're protected, this is what we have to do. As a city, because our charter says that we have to end our budget balanced, we have to, it's this back and forth that has to be done, because we might not need as much overtime, because the chief has done a really good job with bringing it down. Because when I came here almost 10 years ago, the overtime was just all over the place. At least consistently, he's bringing it down. But the reality is, when it comes to safety, it's unpredictable. You're gonna have overtime. So I ask my colleagues to please support this transfer. Thank you.
Thank you, Alder Morrison. I see Alder Festa and then Alder Rodriguez. Alder Festa.
Thank you, Vice Chair Marchand. I just want to make a note that it would be really great, since budget season is coming up, to see real numbers for overtime in the budget, so we have a realistic vision of what that budget is versus having to do these transfers of kind of the unknown. Also, you know, it would be nice to maybe reconsider doing a staffing study, and I believe, you know, with Chief Alston, possibly doing additional classes to reduce the overtime would be helpful as well. And, you know, let's remember, these transfers are done also pre-COVID. We have the excuse of COVID this year, but we have also had to make transfers in the past pre-COVID. So once again, I reiterate that I think it would be a good idea for us to budget realistic numbers, so that when it's time for us to look at the overall budget, these transfers are minimal. And to Mr. Cannon's point as well, we do, I believe, as a finance committee, always bring up the fact that there's outside money that comes in, like the $3 million from Yale. And we do consider that when we make these transfers. We consider all of our monetary funds that come in when making these transfers. So as a board, yes, we do. And it's also questioned. So thank you, Mr. Vice Chair.
Thank you, Alder Festa. Alder Rodriguez.
Thank you, Vice Chair. I would really like to say that I appreciate our fire department. I think the timely responses to the calls is very significant. The quality of the work that's being done. I like the fact that our Chief Alston is thinking creatively and is looking at ways of how he can address the overtime. However, I find that our city is being financially burdened because we have a hub of so many care services. It would be great if there was some sort of way that we could measure and survey so that we can continue to get additional reimbursements to help the financial burden that our city faces. Our residents shouldn't suffer and have to pay more taxes because we're taking on and taking care of so many people throughout the state of Connecticut that are coming into the city to receive the care services. We have private, we have non-for-profit, we have semi, we have independent contractors, we have individuals in their homes providing services to all sorts of individuals because of all sorts of illnesses in New Haven. And I think it's time. If we were to do a survey of the entire state of
Alder
Connecticut.
Rodriguez, I would like to remind you that the item before us is a transfer. I think your point about the city seeking additional state resources because of the over concentration of social services makes sense, but this is not a workshop on that topic.
Okay, thank you.
So please wrap it up.
Thank you, Vice Chair.
Are you speaking in favor of the motion to transfer these funds?
Yes, I am. Thank you very much.
Thank you. Your point was well taken. I see Alder Hurt.
Thank you.
Thank you, Mr. Vice Chair. I want to echo my colleague, Alder Jeanette Morrison. I am in favor of this transfer. These are our first responders. On every call that I have seen within my community, within my ward, they were the first on the scene, and, the fire department. And I want to commend them for a job well done, Chief Austin. But, you know, this is where we are right now within our city. And this is important. So let us support this transfer. Thank you, Mr. Vice Chair.
Thank you, Alder Hurt. Any further discussion on the motion to approve this transfer? I will just say a couple of things briefly. One, I reiterate my comments of support for the fire service and join with other colleagues who've shown expressed support for these hardworking people and the important services they provide. I just wanted to address a point that Alder Fester made during the questions, which is, when is an appropriate time to request a transfer? Should it be earlier? Should it be later? We know that there's going to be a transfer at the end of the year anyway, so why not do it then? And I think from my perspective, as a member of this committee for some years, I think making transfers a little bit earlier is part of the city trying to course correct its finances and its fiscal management. It's trying to not have too large variance at the end of the year, because making transfers throughout the year is a way of adjusting the approved budget to adapt to changing circumstances. And I think if we leave it to the end, then that house may be too messy to clean up. And frankly, budget transfer requests are a reflection of changing circumstances, but they're also a reflection of changing priorities and changing thinking around the direction a department or a service needs to go in. And so I think it also is helpful for us as a committee to hear of these changes spread out over time and not all at once, because then it's more difficult for us to comprehend what are the changes, what are the changing circumstances that our budget needs to adapt to. So I would just say that I think it makes sense to make transfer requests over the course of the year. Now, the underlying question is, do we feel like this is a legitimate use of funds? Well, the money's been spent, so it's not like if we deny the transfer, it doesn't mean like we take the money back from the people who made the overtime. So, this is a mechanical thing that we're doing. But I think we should, as a committee, express our concern to the chief and set a little bit of an expectation about the kind of presentation we want to have during the budget process when he comes before this committee to justify a proposed budget request for next year. And of course, the issue of overtime is going to be an important issue, as is the issue of staffing, as is whether or not Chief Alston and his administration have done an appropriate level of scrutiny and study over staffing configurations, what's needed, what's appropriate, what's current, what are the gaps between what we have now and what we would need. So I would say it'll be good for the chief to know that this topic is the topic specifically of overtime, but more generally of staffing, is definitely a hot topic, an important topic for us to discuss during the budget process, which is only just a few weeks away. But and I'm sorry, Chief Alston, the public hearing portion is closed, so we are not able to recognize you at this time, but thank you for raising your hand. I would say that I'm in favor of this transfer and I encourage colleagues to vote on a favorable recommendation. Further discussion from colleagues on this item? Seeing none, we will call the roll. Alder Marchand, yes. Alder Santiago,
Definitely, yes.
Alder DeCola,
Yes.
Alder Morrison,
Yes.
Alder Walker Myers,
Yes.
Alder Festa,
Yes.
Alder Furlow's not here, Alder Rodriguez,
Yes.
Alder Hurt,
Yes.
and Alder Decker.
Yes.
The motion carries. I see Alder Morrison.
I'm gonna try it. I make a motion that we adjourn.
Second.
The motion has been made and seconded. Is there any discussion on the motion? Seeing none, we will call the roll. Alder Marchand, yes. Alder Santiago,
Yes.
Alder DeCola,
Yes.
Alder Morrison,
Yes.
Alder Walker Myers.
Yes.
That's a yes. Alder Festa,
Yes.
Alder Evelyn Rodriguez,
Yes.
Alder Hurt,
Yes.
Alder Decker.
Yes.
The motion carries and we are adjourned. Thank you, everybody, for your patience and have a good evening.
Good night.
Good night.